Welcome to Module 7, Proof of Diagnosis in Labs. For clients to be considered medically eligible for BDAP, they must be under the care of a licensed provider and they must provide the following documentation. They need to provide us with diagnosis information when they're a newly enrolled client only, not a returning client. And diagnosis information can include any of the following. Confirmation of HIV diagnosis from their treating provider, which could be as simple as a statement signed by their provider saying that they've tested positive for HIV and on which date. Or it could be a copy of a confirmed positive test result, which may be the Western blot, IFA, the multi-spot HIV-1, HIV-2 rapid test, or a positive nucleic acid amplification test, or PCR, or a copy of their viral load that shows a detectable quantity of virus. Any labs that are used from CareWare to be used for proof of diagnosis should feature a detectable viral load of over 20 copies. Similarly, the BDAP requires that clients have their labs drawn once every 12 months. These should be reported to HHS surveillance and then entered into both CareWare and REMI for you. We look at the following. We look to see if a viral load has been drawn within the last 12 months from the date that the application is being submitted. If a client has a CD4 cell count that was drawn but not a viral load, we do not count that as satisfactory lab results because a CD4 count is not required, but a viral load draw is. So when submitting a BDAP application, we ask that you please confirm a client's most recent lab result. Labs should be dated within the last 12 months of the date of submission. So in the example below, you can see the client's last viral load lab was listed as July of 2022, which of course was greater than 12 months ago. In the case that a client is overdue for labs, we ask that you take the following steps for us. The first step is to check CareWare to see if more recent labs are available and have been imported into CareWare. HHS surveillance receives labs and imports them into CareWare every week. So these are then imported into REMI. So there may be a delay in transferring this information if your client was just recently seen. And please note, we are aware of significant delays with out-of-state providers reporting lab information to Iowa surveillance. So if this applies to you, please see our next set of notes. If more recent lab results are not reported in CareWare, we would ask that you contact the client's provider's office to obtain verbal lab results. If you have access to the client's electronic health record, you may update the lab results this way, following your agency's protocol for accessing client charts. You may need a release of information on file to call the provider's office, so please follow your agency or your provider's policies for obtaining this information. Once you've received that verbal confirmation, we would ask that you do not enter the client's viral load result in REMI with the date. You would just please enter that information into the comment box and also alert the Ryan White Data Help team of the new result so they can be on the lookout from surveillance. So again, we ask that you update the viral load results in REMI in the comment box only, making a note of it, rather than trying to update the lab result manually. If the provider confirms to you that a client was not seen in the last 12 months, please make a note of the client's next scheduled appointment in the comment box of the core section. And this next slide will include an example of what exactly we're looking for. So in this example here, client is a household size of 2, has income from employment and insurance from their employer-sponsored insurance plan. The client is able to fill his medications at Nucara. Client's last labs are from July of 2022. The case manager checked CareWare and confirmed that no newer labs were available. The case manager checked the client's electronic health record and confirmed that the last labs were in fact drawn in July of 2022. The case manager called the client to check in on the status of labs. The client reported that she had attended her visit in July of 2023, which is supported by the electronic health record. At this time, her provider did not take her labs. The client was supposed to return to have labs drawn at another date, but has not returned to have them drawn. The client scheduled an appointment on Monday, April 29th at 8:30 a.m. to have her labs drawn. The case manager is requesting client remain in process until her lab results are updated. Again, when someone is overdue for their labs, we will place the client in process while waiting for lab results, so the client will be able to continue to fill. Nucera will check with BDAP at the client's next fill to request permission to fill meds. This will prompt BDAP to check for more recent labs for the client in both REMI and CareWare. If new results are available, we will reach out to you to let you know that more recent labs have been updated and that you should submit a request to remove your client from in process. But if no results have been updated, we will be reaching out to you to request an update to determine if the client attended their scheduled visit or had labs updated. The client will be able to continue to fill, and BDAP will continue to reach out each month to follow up on lab results. Again, we are aware that if your client sees an out-of-state provider with known delays in reporting labs to Iowa HHS, we ask that you include a sentence in the comment box of the core section attesting to this delay. So here's an example on the next slide. Client is a household size of 2, has income from employment and insurance from employer-sponsored insurance. Client is able to fill all medications at Nucera. Client's last labs are from July of 2022. The case manager checked CareWare and confirmed that no newer labs were available. Client sees an infectious disease provider in Nebraska, and due to the provider's privacy practices, the provider's office will not release lab results to case manager, even with written release of information. Client reported that she had attended her visit in July of 2023. At this time, her provider did not take her labs. The client was supposed to return to have her labs drawn at another date, but has not returned to have them drawn. Client scheduled an appointment on Monday, April 29th to have her labs drawn. The case manager is requesting client remain in process until her lab results are updated. In order for clients to have their labs imported into our system, they must have a signed and uploaded case management enrollment agreement. So please email the Ryan White Data Help Team if there is a lab discrepancy. It's been greater than a few weeks since their most recent visit and their labs are not showing available.